You need to love what you do and do what you love, and I consider myself very fortunate because I do that each and every day. I love patient care, I love our families and our staff, and I love being part of creating an environment where we can make that difference in people's lives each and every day. Tonight is very special. I am very happy to be able to share the wonderful attributes of Isabel Wayrick. She's been an active member of our board, and most importantly, she's been an active member of our community.
I think there's a joy in giving back. It's not always money, it's time, it's talent. There is a certain responsibility, I think, to do that, and I think there's a certain joy that comes with doing that.
She's passionate and she's committed, and she puts her time into making things happen.
Well, I like to share my photographs because I realized I've been to some wonderful places that many people can't get to, especially children. Maybe it'll bring a smile to someone's face.
She's been a member of our Cultural Transformation Committee to help us change the environment to make the patient experience be the best that it can be.
When I first got involved with Chilton's strategic plan, I was assigned to a committee called Cultural Transformation, and I wasn't exactly sure what that meant, but it meant they were trying to answer the question, what can we do better to improve our health care? They want to give compassionate service in a friendly environment, and I think that comes across, but they worked at that.
We are extremely excited about our partnership with Atlantic Health System. We share similar values, mission, and vision. We believe we're very fortunate to be able to work in partnership to create world-class healthcare right in our local community. Over the last few years, we've been focused on growing our advanced technologies. This year, we've added a 3D mammography for our advanced screenings and diagnoses for breast cancer.
3D breast tomosynthesis is an exciting new breakthrough technology in breast cancer screening. It's able to deconstruct and separate the breast tissue into layers. We are one of a few hospitals in the area who are having this installed into our breast centers. As mammographers, we want to detect breast cancer in the smallest size, earliest stage possible, because that's what opens a door to better treatment options.
We have fantastic staff who help the patients experience that warm and compassionate care and a very clinically comprehensive environment.
There's no question that everybody on the team has to be on board with providing excellent care with the goal of having as positive a patient experience as you can. A few years ago, the hospital elected to create a total joint center, offering more of a personalized knee replacement. And what that involves is some preoperative imaging studies. As a result, the cuts that we make should be much more accurate because they are based on state-of-the-art imaging and preoperative planning that is done before the patient even gets into the operating room. The goal of the knee replacement surgery is to reduce pain and improve function. And fortunately, I would say that occurs upwards about 90 to 95% of patients. Chilton ranks 4th in the state of New Jersey and 1st in Morris County for knee replacement surgery.
Each staff member considers it truly an honor to be able to make a difference in the lives of our patients and their families.
Everyone here understands that it's not just a disease we're treating. It's a patient, the patient's family, and anyone whose lives that patient has touched.
Chilton would be the quintessence of a community hospital by virtue of the fact that it's in a neighborhood, it's across the street from a high school, and being in the community, I think there's a symbiotic relationship that the hospital has to do for the community and the community has to do for the hospital.
I hope you share the excitement that I have for the future of our hospital and the services that we provide to our community. We will be successful if we can count on each and every one of you for reaching out to your friends and colleagues to continue to support our hospital. With your help, philanthropy will be the opportunity for us to really make the breakthroughs I believe our community deserves.